So after working on hip extension, we're going to work on innominate extension. So in order to do this, a really great position is inside lying, actually. So inside lying, this is a really important one to protect the lumbar spine. We want to really make sure that we're not taking lumbar spine into extension. So in order to do that, I take the hips up. And is that okay? Mm-hmm. Okay. Then from here, as long as we can maintain this up, you could use a belt and attach it to the top of the table just to anchor it. You could have the patient hold their knee up also, or you could just kind of monitor it with your eyeballs, making sure that we don't lose that hip flexion position so that we don't overextend the lumbar spine. Biggest consideration here. Now, in order to get to lumbar spine, we've got some tightness on the front of this leg here. All right, we got quad wanting to straighten the knee out, and we've got a lot of anterior hip tension. Now, ideally, we would treat all that out first, okay? But in this case, we can only go as far as the hip will allow us to extend when the PSIS starts moving. So I'm actually going to let her extend her knee a little bit. That might give me a little bit more range. But I'm going to bring my hand, come around to the side here. I'm going to bring my manual contact just inferior to PSIS, okay? And I'm going to create kind of a key grip there onto PSIS. Now I'm going to have a nice broad stance so that I can just weight shift towards innominate extension. Yep, and see, we already started losing that, so she grabbed her leg. So right here, I get a bit of a hard infeel. My manual contact is I am trying to keep my arm connected to my body, and I am basically pushing through my left leg, creating a rotation, left rotation of my pelvis so that I can rotate into her PSIS. All right, very important. Don't try to just arm it here. You got to make sure that you're using your body as a therapist here to rotate into the body. Now, her quad's tight. This is not an ideal manual contact on her leg. I would much rather be here, okay? So now I can hold her heel into my side. I can support the rest of her leg with my hand underneath her knee, and typically that's very comfortable for clients. Now I come back into that position. I go into that weight shift. I'm able to engage inferior portion of PSIS superiorly, okay? Now I have my infill, and now I can have her pull her knee forward. So she's trying to march her leg up. Yep, and I'm just blocking that and let that go. And I can see if I can take up any slack. I can a little bit there, and then don't let me pull you back here. Try to march up. That's it. And let it go. Very stuck on her. We need to work on this. So this is innominate extension and side lying. Make sure you try to clear the hip into extension as much as possible first, then go into innominate extension. Also a great position to re-educate the innominate and hip into extension as well, although we may show that re-education on another video.